Many people in America suffer from obsessive compulsive disorder. 2 million Americans, which is 1 in 40 adults, are diagnosed every year. This disease is misunderstood because of the TV shows and the way they portray as some silly joke, like Sheldon off of The Big Bang Theory, and how he has to sit on a certain section of the couch every day or do some quirky rituals to go on with his daily life. But it's important to understand the disease because it can affect anybody at any age, and it's a serious disease that requires medical attention. The National Institute of Mental Health defines OCD as a common chronic disorder where a person has uncontrollable thoughts or behaviors that he or she feels a need to repeat over and over. Some compulsions are something that we can see, like somebody unlocking and locking a door to make sure intruders don't go in, but some of them are also mental, like intrusive images or unwanted impulses in the mind that we can't see. These compulsions are irrational and uncontrollable, but oftentimes the person with OCD tries to neutralize them and avoid situations that triggers them. Lots of research has gone into finding out what causes OCD to find a definitive cause, but researchers can't pinpoint an issue that is linked with somebody developing OCD. Many factors are related with the development of OCD, including behavioral, cognitive, or environmental factors. The National Institute of Health conducted a study, and the results showed that OCD is maybe associated with a mutation in the human serotonin transporter gene. These OCD can be a genetic or environmental problem, caused by genetic or environmental problem, and 25% of sufferers of OCD also have an immediate relative that is a sufferer of OCD. If you or someone you know is suspected of having OCD, watch out for these signs, although it may be difficult to understand the signs of OCD because all humans have impulses and strange compulsions that go through our brains every day that affect our daily lives. According to the American Psychiatric Association, these compulsions and obsessions are really repetitive. Some examples of stuff that we can see are like locking a door multiple times or excessively washing your hands if you're afraid of germs, arranging things multiple times, or counting in a repeated manner. An example of a mental compulsion is saying nonsense words to get an intrusive image out of your head. Kristen Fuller, MD, writes a blog called A True Story of Living with Obsessive Compulsive Disorder, where she talks about tying and untying her shoes repeatedly for an hour every morning before going to work as a result of her OCD. Treating OCD can be easy for some and more difficult for others. It's typically treated with drugs like serotonin reuptake inhibitors that reduce symptoms because they help your body go back to the normal way it transports serotonin. Serotonin is the mood and anxiety hormone in your brain, so it is greatly affected by obsessive compulsive disorder. Antidepressants are the next medication that can be given. If all of these don't work, antipsychotic drugs can be used. Sometimes it's difficult to treat obsessive compulsive disorder because it coexists with other anxiety, depression, bipolar, autistic, or tic disorders. Dysmorphic disorders like pulling your hair or skin picking disorders also coexist and have a remarkably similar symptoms as OCD. In these cases, behavior therapy is the most effective treatment. Cognitive behavior therapy is a specific treatment for OCD, and the therapist gradually exposes situations that trigger the people's obsessions in hopes that they take frequency and intensity of these compulsions and are decreased. This therapy takes more bravery on the behalf of a person with OCD, but free time without anxiety helps motivate the people to push through the therapy. Overall, obsessive compulsive disorder is a crippling disease. It's important to understand the symptoms because TV can confuse people and show symptoms that aren't actually accurate. With the right treatment and support, someone with OCD can control compulsions and live a relatively typical life.